Good afternoon, everyone. Thank you for joining us. I'm just waiting on one of our panelists to rejoin us. That's Dr. Harrison. So she has logged out and she's trying to come back in. So can you just give us like a minute or two for her to come in? Okay, so Dr. Harrison, are you with us?
I am, but I'm still having that challenge with the camera, so I'm going to try another device.
Another device? Okay.
Yeah.
All right. Okay, thank you. Francesco, there's one announcement before we begin. So there are some persons who are trying to get in from the registration, but they're not able to. Can you assist them, please, by sending them the link?
I still want to try.
Okay, will do.
Thank you. Okay.
Elevate this.
All right, thank you, Dr. Harrison. Good afternoon, everyone. Sorry for the delay and the technical difficulties. So we're up and running. So I'm Carol James Bateman. I will be the moderator for this segment. And the title is, just to make sure that you're in the correct room, the title is "The Struggle is Real, Preserving Your Mental Health During the Pandemic." You know, I want to start out by first thanking our panelists for taking the time out to be here with us, to share their knowledge, their expertise. I'm really excited for the discussion that we're gonna have today. I would like to thank our technical team for being here to support us, Francesca, our media personnel. I'd like to thank Dr. Chambers from the University Health Center. You guys would have seen a video where she's giving information on the resources that we have to offer, and to our audience for showing up with your questions. We hope we'll be able to answer your questions today, at least most of them. So I'm just gonna introduce you guys to the format of the panel before our panelists go through their own introduction. So the format is, you may wonder, why do we have this compilation? So we have psychologists. Obviously, we will be discussing a lot of mental health issues. We have our physician. Obviously, we need to take care of our physical health. And we have our researcher. Now, I think that oftentimes our researcher doesn't get a lot of credit, because without their work, we're not able to put proper measures in place, interventions. So with our researcher being here, it allows us to get a better understanding of the data that we're seeing, but also for us to make the connection between intervention and research. So research and practice. And secretly, I really just want my students to be encouraged to do research. So I have also a hidden agenda. So the format is, we'll have 30 minutes where I will ask the panelists questions. And keep in mind that we've gotten a lot of submissions, more than 130 questions. I've tried my absolute best to lump them in themes, but not to worry if I've missed your question. You do have an opportunity to ask in the segment where we have 40 minutes of discussion, and then we have 10 minutes just to wrap up and close. So just to get you familiar with our panelists, I'm doing something that is a little bit unusual, and I'm going to ask each of our panelists to do a brief introduction. So should we start with our researcher, Dr. Powell?
Not quite sure you should have started with me, but thank you, Carol, Dr. James Bateman. My name is Marvin Powell. I am a researcher, apparently. I am a quantitative methods faculty at George Mason University in Fairfax, Virginia. My research interest is centered around, applying quantitative methodologies to otherwise non-quantitative space, oftentimes looking at from a critical lens. And most recently, I've been dabbling in looking at the impact of humor on statistical anxiety and statistical self-efficacy. So thank you, happy to be here.
Thank you, Dr. Powell. Okay, and then we'll move on to our physician, Dr. Harrison.
I had a feeling you were coming to me next, All right, thank you very much, Dr. James Bateman. So I'm here really to give a different perspective, more from the medical side of things, but also I think I'm here because I'm passionate about young people, and I'm passionate about people's emotional and mental health. And I think it oftentimes doesn't get enough credit from the general person, but more importantly, even from us as physicians. So I think that's my piece to add to the panel, I guess. So it's great to be here. Thank you very much, Carol.
Thanks, Dr. Harrison. And then we move to Dr. Webb.
Hi, good afternoon, everyone. I am Zooming in from Atlanta, Georgia. So I'm so happy to be here. And thank you so much, Dr. James Bateman. She and I met through the field of eating disorders. I treat eating disorders, and that's how we met. So I was so excited when she invited me to be a part of this panel, because this is a full circle moment for me. I was born there at the university. I am so happy. I wish my mom could be here to see this. And my uncle is the one who delivered me right there on campus, Professor Hugh Winter. So I am it's just a proud moment for me right now. I'm a licensed psychologist in private practice here in Atlanta, Georgia. So I treat adolescents, adults, couples, and families with various mental health issues, depression, anxiety, eating disorders, different issues. So I'm here to share my education and training and experience and answer as many questions as I can regarding those issues. So again, thank you so much for this invitation.
Thank you, Dr. Webb. And then our final panelist, Dr. Bowie Dean.
Good afternoon, everyone. Thank you so much for having me. I'm Jody Bowie Dean. I am a counseling psychologist. I'm fortunate enough to be able to dabble in teaching, research, and clinical practice. My area of specialization broadly is trauma and discrimination. So I work a lot with individuals who've had traumatic experiences, and work mostly with young people in my private practice, and of course in teaching and supervision. So I am excited, glad that Dr. James Bateman has invited me to have this discussion, and just looking forward to what comes out of it.
Okay, thank you, Dr. Bowie Dean. So I'm gonna move straight into the questions because I can imagine that persons are really listening out to have their questions be answered. So I'm gonna start with Dr. Powell. So Dr. Powell, there seems to be a lot of research that's coming out in the US about COVID-19. How applicable is this to the Jamaican context?
Well, that's a great question. Thank you, Dr. James Bateman. There's a lot of generally, certainly in the US because of proximity, why why it seems so close in terms of that's where all of the information is coming from. But certainly worldwide, the last year and 3-4 months, a lot of research is being done and being conducted around COVID specifically. It's important that we also know that this isn't new in terms of, yes, the COVID-19 is a specific strain, but research have been done regarding coronavirus for a long time, and I don't want to jump the vaccine question that I'm sure is going to come. But I just want to put that out there very quickly off the bat that people have been trying to develop a vaccine for coronavirus for a long time. It's not just because of COVID-19. So research has been going on for a while surrounding this. There's a lot more research now on how COVID impacts particular people from a race and also a gender perspective, not just biological impact, but also social impact. And I know there are a couple of questions that will come that gears in or just jumps into those specifically. But in terms of how those research applies to a Jamaican or even a Caribbean context, not very different, right? At the end of the day, there's some social differences inevitably that will take place in terms of access based on race versus access based on class in Jamaica. But there's a high correlation between class and race in a lot of spaces. So in short, that there's no difference. There's no large difference in terms of the research that's being found, specifically looking at African-American people who are getting COVID versus Jamaicans who are getting COVID, right? Or even in terms of no difference in terms from a social perspective, from a biological perspective. Sure, there's at the end of the day, unless you're, some people have underlying conditions, others don't, and we're finding the research is suggesting that the same impact is taking place irrespective of where you are, if you have those underlying conditions versus healthy. also there's still some nuances that can't be identified. You'll see some people have a particular reaction, and it's not specific to their sex/gender, or it's not specific to their environment or anything like that. It's just innateness, that individualism, that it's difficult to generalize that because it's specific to that individual. So there are some differences across those as well that it's difficult to account for those. But there's a large amount of generalizability across the US and Jamaica and in the rest of the world regarding the impact that it is having socially as well as biologically. Okay. And again, there are a couple of other things that I'll jump on when I'm asking or responding to some more questions. So I'll pause there for now.
Okay, thank you, Dr. Powell. I'm so tempted to get into the vaccine and research around that, but I'm gonna delay that that impulse. So thank you. So it seems as if what you're saying is that we're all experiencing the pandemic, and we can generalize what is currently happening. We've seen where the research is showing us that there's a spike in mental illnesses, and it's certainly becoming even more prevalent. What is your take on that? And then I'm going to bring it to the psychologist and the physician to tell us what they're seeing in their practices.
Thank you again. Before we started, or when I was asked to be here, I did a quick search about mental illness and the COVID and the impact that it has on an increased mental illness component. And it is first of all, let's just say that it's widespread. It's not US specific, or it's just a people specific. And let's just say somebody has to stop going to work because of COVID, right? Whether they have it or not, or because they've been let go, because they're in a restaurant, or they just don't have access to work at this particular point. So there is this level of I don't have the finances, I don't have the money to pay my rent because I don't have a job, which increases levels of depression. It increases mental health issues and concerns. One of the things that popped up a lot in the research recently because of COVID is also, unfortunately, I don't mean to smile, but there is, people have to spend more time at home in their relationship. And sometimes, and often, you've found that people, when they left home for work, it was one way of getting away from particular types of relationships. Mm-hmm. So you realize that there's also an increase in domestic abuse. There's an increase in child abuse. There are increases in all of these things that are compounding the levels of depression that one was probably being shortened because they didn't have to be in front of it, and know that they are, and they can't escape it because they can't go outside, can't go to work, can't go to play football or wherever. So they have to now confront this, and there's this uptake. There's an increase in all of these mental health activities and problems, issues because of this COVID.
Yes. Okay. Thank you, Dr. Powell. So let's talk to the psychologists, Doctors Webb and Bowie. Do we have evidence of this in your practice? Mental health issues being on the spike since COVID?
100%. This is the busiest I've ever been in my practice, and I've been practicing since 2002. So, 19 years, and this is the busiest I've been. Also, yeah, even amongst my colleagues, so mental health professionals have been struggling, and then this is, it's been tough on frontline workers, physicians, mental health providers, what have you. So initially, last March, I think initially I was seeing more anxiety. Still I'm seeing some, but I think the initial spike in mental health issues was anxiety, sleeplessness, increase in food intake, eating more, gaining weight. And then over time, that's when the depression was settling in because of the social isolation, in some cases, economic issues, because by then folks were losing their jobs, and substance abuse issues. Again, addiction is not my specialty area, but however, my clients who didn't initially come into therapy for addiction issues, they, all of a sudden now they're finding themselves usually drinking more, what have you. So it just exacerbated so many areas. And like Dr. Powell said, relationship issues, marital conflict, or what have you. So I feel like I am having to be more of a generalist now, seeing, more issues than I have seen earlier in my career. And as providers, myself included, because my anxiety increased at first too, because I just was like, I'm gonna get it. I know I was, didn't want to touch my husband. I was like, no, go away, shower before, because he was going back and forth to work. I was blessed to be able to do telehealth from home. But I even myself, I had to use more meditation. I had to, allow myself to get out and walk in my neighborhood or just get fresh air outside of my house at the time, so definitely.
And I'm happy that you touched on that for the healthcare providers also, because they're having to step out and having to support and having to help. So there is also a need for persons who are in that sort of position to be able to take care of themselves also, because otherwise we won't have the help or the support there. So thank you for highlighting that. So we're hearing what's happening in the States. Dr. Bowie, what is happening in Jamaica? What have you seen in your private practice or in your practice?
Sure. Well, I would echo pretty much everything that Dr. Webb said. There has definitely been an increase in the demand for therapy services. Even for my clients that I was seeing prior to the COVID wave, a lot of them are struggling even more now. And what I have seen in general is kind of a wave or a series of waves. I think the initial stressor was anxiety and stress about, the unknown at the time, about a year ago now. And as time went on, you start to see different problems emerging as a result of this pandemic being stretched out and going on for longer and longer. People having difficulties with employment, working from home, a lot of family issues. So people having difficulty with their family members and in their relationships with family members and people they live with, because we're now all stuck at home, or we're stuck at home, forced to tolerate each other for longer periods of time. And unfortunately, I've even seen a couple of situations where the pandemic or the effects of the pandemic have caused some families to rupture and to break apart in some ways, which has been devastating. This has been particularly difficult, I think, for young people. I think initially when a lot of us, a year ago, were probably optimistic about how long this would go on for. And so what we were seeing was that the kids were struggling because they weren't in school and, they weren't able to go out and see their friends, etc. And young people were struggling. And most of us older adults kind of were holding on to the hope that, okay, you know, we'll stick this through for a while and see how long it goes on. And COVID fatigue has really set in now for pretty much everybody. I have folks who have older parents and grandparents who they're having difficulty getting their grandparents to stay at home or their parents to stay at home because everybody is frustrated. Everybody is, you know, our response to this pandemic is similar to our response to any other threat. And so the whole fight, flight, freeze, fawn response, different people are responding in different ways to this threat, this societal threat. And it's been difficult for everybody, myself included. And I don't think any of us would deny that it's been difficult for us.
Yes. Thank you for that. I'm wondering, so it seems like generally yourself and Dr. Webb, you work with the clinical population. What about persons? Because we've mentioned that the stress affects everyone. So how do we identify individuals who need help and how do we support them? Do you have any advice for that?
Well, I think one of the very first things we have to do is you can't identify something if you don't know it exists. And so the first thing we have to do is normalize discussing these issues, discussing our mental health, discussing our emotions. You know, whether that's something you're used to or not, we have to normalize having those discussions with people you trust. We have to normalize the practice of reaching out for therapy. Therapy is not just for people who are in distress in the moment. Therapy, some of the most powerful therapy experiences can happen when an individual feels like they're thriving, you know. So I think the first step is to normalize and be open about discussing people's difficulties. One of the things I did in last semester when I was teaching was I would try to set aside 5 minutes at the beginning and at the end of each lecture, online lecture, to just kind of check in with students and ask, how are you feeling today? How are you feeling in this moment? What's going on now? What's happening in the semester for you now? How is everybody coping? And it was kind of this repetitive thing, and it felt like the same questions over and over. But I think even that ability for students to type in the chat to say, I'm feeling really anxious, I'm really tired of this, it helps people to feel seen, and it also gives people practice with being open and talking about what their experience is. This thing is so overwhelming that it can be easy to get lost in the cloud of COVID and get lost in our own depression and our own anxiety and just feel like, well, this is my new normal. And we have to try to fight that. And we do that by just talking and having open discussions about what's going on with us internally.
Yeah, I like that. So being able to validate, so acknowledge and validate what's happening on the inside. And I've also found that in classes, having the open discussion allows other persons to realize that they're not the only ones experiencing it. And that acts as a bonding moment. And certainly the fact that we're having this discussion right now allows us to normalize what is happening and get some answers here. So thank you. Dr. Webb, do you have anything to add to Dr. Bowie-Dean's response?
I think Dr. Bowie-Dean said so much in terms of the normalizing it and making aware. I mean, I think psychoeducation is important. And what I mean by that is I didn't know anything about, you know, symptoms and diagnoses and everything until I went to graduate school. Even as an undergraduate, I didn't really know much. And so sometimes the way we share information of this is what depression looks like, and being, you know, specific about some symptoms, because people may not realize that, kind of me feeling like I'm having difficulty concentrating. That's a symptom of depression, as well as some other things, but difficulty concentrating is a symptom of depression. You know, indecisiveness, difficulty making a decision, you know, what do I want to eat for dinner? And just sitting there and like pondering this for a while, those that can be a symptom of depression, or symptoms of anxiety, gastric GI issues, waking up nauseated and feeling like you're about to vomit. I mean, that's not normal. It could be something else, but it could be anxiety. So I think kind of educating folks on what are some symptoms and, what's the difference between mild versus moderate versus severe anxiety or depression or what have you. And so folks, and not for folks to self-diagnose. We don't want people going around, necessarily, but know enough to say, hey, this is what's going on. These are the symptoms I'm having, and talking to either a therapist or a physician or what have you, and saying, is this normal?
Yeah.
And letting the doctor diagnose,
Yes, I agree. When do we know that we're in trouble? So let's say some persons are experiencing some depressive symptoms, which we all experience even outside of a diagnosis. When do we realize that we're in trouble?
I would say, when you really are not functioning well, you're realizing that you're starting to isolate, withdraw, have difficulty engaging activities you used to usually do very well with, getting up, getting dressed, getting something to eat, completing work, what have you. So intensity of symptoms and frequency, I mean, is this something that's just, once every blue moon, or is this happening 2-3 days of the week, what have you? Again, there's nothing wrong with asking someone or saying, this is what I'm experiencing. Does this sound normal to you? But, the main symptom I was seeing in my clients during, at the beginning stages and currently with this pandemic is not just the sadness and feelings of anxiety, but sleep issues, like I said, eating issues, withdrawing, not even wanting to connect on, with friends for a birthday Zoom call or what have you. Those are some common steps. So if you find yourself engaging in any of those, then definitely, reach out for help.
Okay. Thank you, Dr. Webb. So I'm going to move to Dr. Harrison. So we've heard about the mental illnesses, and we know that psychotherapy or certainly getting some amount of counseling will help individuals. What about management with medication? So persons who are struggling, who need to be placed on meds, but we know that in our setting, at least certainly in the Jamaican setting, there seems to be some stigma that's associated with taking meds. Can you tell us a bit about that, Dr. Harrison?
Sure, thanks. So I would agree, there's definitely a lot of stigma around medications that would be deemed as psychiatric medication. And I would say persons are particularly hesitant to start, and even more so to start it in their children and their adolescents and even their young adults, I think it's made more challenging if a parent in particular has had a bad experience with psychiatric medications personally, or a bad experience that another family member has had. And so sometimes, you just have to take that time to sort of go through the reasons why we might need the medication, to reassure them that, the person is not going to get addicted to the medication, that chances are, especially if it's a child or an adolescent with depression or anxiety, it's very uncommon that they're going to need to be on it for life. But there are many persons who worry that if I start this now, I won't be able to do it by myself, and so I'll need to stay on it forever. So I think part of the message people need to get is that just the same way that for many illnesses, we have to do a two-pronged or a three-pronged approach. It's the same thing with mental health. And so we may need to only use psychotherapy, or we may need to use therapy along with medication, and that we really shouldn't fear that sort of approach. But I do think we also have to give persons time to sort of embrace the concept of medication. So it's always very challenging, to just meet a patient and diagnose them and they say, okay, well, you have to go on that now, and I think Dr. Webb really brought up that point about looking at psychoeducation. So, just letting them know what's happening in the brain, why you're having depression or depressive symptoms, what's happening in the rest of your body, why you can recognize what anxious symptoms are, so that they have some sense of control and understanding over their bodies. And I think that can go a long way, both for the young person who may be suffering or for anybody who may be having the symptoms, as well as for the people who are supporting them emotionally, financially, etc. Our culture is really tricky though, because we just, once you say you're seeing a therapist or you're seeing a psychiatrist, automatically it means you're mad. And we have to really spend a lot of time to work on dispelling that myth and getting rid of that stigma. I think the younger generation is managing to do some of that. I think they are doing way better with that ability to talk about emotional and mental health, but we have to bring the adults on board now. And so things like this will hopefully, spread that word.
Okay, yeah. Thank you. All right, so speaking of medication, Dr. Harrison, there has been some concerns about the vaccine, and I'm also going to be talking to Dr. Powell about this, but given that you're not on the floor, what is your take on the vaccine, taking the vaccine?
Right, so I'm a physician, but my core practice, I'm a pediatrician, right? And we live and breathe vaccines. It is such a central tenet for public health and for preventative care. And so I'm very accepting of the concept of vaccines as one added step towards safety. I think no one thing can do it. So we have to do our public health measures in terms of, social distancing, wearing our masks, etc. But we're not a particularly highly driven population when it comes to being focused on these protective mechanisms. And so, we got to bring in the other things that are also very effective. And so I'm definitely supportive of the vaccine. I know there's a lot of worry in terms of, how good is it? Is it going to prevent me from getting any COVID at all? And there is no vaccine that is 100% protective. I think it's very difficult for adults to wrap their minds around vaccines because you haven't had one in the last 20 years. And so it's really challenging for you, but it remains an important and very effective means of controlling infection. And that's why, most of us have never seen rubella. Most of us have never seen tetanus unless you're 50 or 60 years old. When we had an outbreak of measles 4 or 5 years ago in the States, it was like, oh my gosh, but we don't see those things. The last time we had a major problem with polio was way back when in this part of the world. And that's because vaccines work. And there is no vaccine that's perfect. There's no vaccine that is without side effects. And I think we should allow people to make their decisions with all of the information. But I think we have to say the risk is not outweighing the multiple benefits that you're going to have. So, the number of deaths that we've had so far from the illness across the world, I mean, it is so much more significant than this minuscule number that have been associated with the vaccine, but not necessarily a cause. The vaccine is not necessarily the cause of death. In many of the cases, they're still under investigation. So I think it's critical for us to just recognize that this is one of the best ways to go forward in terms of protection. And I proudly say I've had my vaccine and I'm waiting on the number 2 vaccine because I want to be safe.
Thank you, Dr. Harrison. So speaking of being safe, I'm gonna switch it to Dr. Powell. So Dr. Powell, in terms of the research that has been done on the vaccine, there are some persons who aren't convinced that enough is being done, or the information they've gotten is sufficient for them to be convinced. From a research perspective, what are your thoughts on this?
Well, thank you again, Dr. James Bateman. Dr. Harrison, I touched a really good point, right? The mention of the measles and tetanus, stuff like that. It's just because we have the shots, it's because we have vaccines for it. That is why it's not rampant anymore, right? Had we lax on it 20, let's say even 75, 100 years ago, we probably wouldn't be here, right? So as I mentioned before, we need to recognize that coronavirus vaccine or the tests that they've been doing in the lab did not start last year, right? There have been doctors that have spent their entire adult life who are 30 some odd years trying to work on vaccines, right? One of the things that we need to understand as well is the different strains, and just because they're different strain doesn't necessarily mean that, like Dr. Harrison says, that one vaccine will be able to capture all of them, because that's just how it works. If we think of the flu shot, and I know many Jamaicans typically don't take the flu shot because it's a flu shot, so here it's a little bit more here, as in the States, you do see people line up to get their flu shot. Oh, it's flu season, so and still some people do get the flu or have adverse effect on them, right? And that's just the nature of vaccines. It's not a COVID vaccine. I want to differentiate quick here experimental designs from, just to make it very researchy. So forgive me if it bores most of us at this point, but we want to differentiate, like correlational type studies from experimental type studies, and where we have a treatment and a control group and so forth. And these vaccines have been tested several times using human trials and treatment and control group. At this point, the long-term effects not known, and that's, because it hasn't been around long enough for it to be known, but certainly it is an added component that can protect us from our current situation. We still have to do more things too, socially, like, you've been vaccinated, but you still wear your mask, because there are other bits that's running around out there. There are other strains that we have to protect from, that the particular vaccine that you received hasn't completely controlled for. So there's still other measures that we have to put in place. And I know it seems frustrating, and that we potentially could be wearing masks for maybe another 6, 7, 8 months, probably even a year. It sounds frustrating, but until we get our handle, I'm talking about we as if it's my team, but we as a people, until we get a handle on all of the strains that's jumping up and down around there, then we still just have to do with what we can. And the vaccines have produced enough positive results to be able for us to say, this is something that we can trust. The research shows it. They've had many trials before the ones that are being given to humans right now. Some worked, some didn't work, and they've tweaked it to a point where it's working. But we're all individuals, and we're made up differently, and we have different reactions to these things. So we just have to continue. We're continuing the research, so we just have to keep an eye on it, and I'll talk more about that at some point.
Okay. Okay, thank you, Dr. Powell. So we've spoken about physical safety. Can we go back to maybe more of mental safety? So for persons who have contracted COVID-19, they've mentioned that they've had some challenges with discrimination. Dr. Bowie, can you assist us with this? How can they cope with the reaction from other persons having contracted COVID-19?
Or well, it's very unfortunate that that type of discrimination exists, because of course none of us go out or wake up in the morning seeking out this disease. Of course, safe practice minimizes our chances of getting it, but there's still the risk, you know. So unless you're completely isolated, it's difficult. I'm kind of wondering if I should share something personal, but that maybe won't. So that's a challenge, right? I think one of the things that's important is for an individual to have a very strong and firm sense of their own identity, and who they are, and their own sense of worth. The reality is that discrimination in any form exists. And we know that discrimination has an impact on mental health. The research shows that across the board. And one of the biggest buffers against that, we know things like sense of self-worth, self-esteem, prior mental health, so what your mental health is prior to experiencing discrimination. And so there's not a lot that we can do to prevent others from saying what they want to say or treating us unfairly, but we can protect ourselves mentally and protect our own sense of self. And that starts with having a good foundation for your own mental health to begin with. But also recognizing that your worth is not tied up in what somebody else thinks of you. What can be difficult with this is that along with that discrimination in terms of what people say, there's the pushing away, right? And people push you away, and you feel isolated from others because they no longer want to be around you or spend time with you. And that can be particularly difficult and hurtful. Try to educate others as much as you possibly can around the facts of COVID. And then the reality is that, sometimes we have to just be aware that we're not in control of other people's minds, other people's decisions, other people's actions. And so focusing on ourselves and focusing on how we value ourselves and knowing the truth within ourselves is going to be a critical buffer in that regard.
Yeah, I appreciate that in internal work. So not controlling the external world, but monitoring what's happening internally and working on that, because yes, you are correct. We can't control the reaction of others. And when we don't feed into it, then it, eventually things will become more normal. So if we're not becoming reactive, then we stand to gain more benefits as opposed to trying to control the external world. Okay.
Dr. James, can I interject? I apologize.
Sure.
I just want to pick up on something that Dr. Bowie mentioned, and that's just the lack of knowledge. I think in many cases, stigma is driven by two things: fear and a lack of knowledge. And so I think most people will realize that the amount of stigma that was there last year, if you got COVID positive, is a little less this year, I think, because we have a better understanding of how it spread, etc. And we know so much more about it. But, maybe I'm older or old enough to remember back in the day when HIV had immense amounts of stigma. And through education, we're slowly bringing that down. But so I think we're seeing a lot of that here now. And so it's just to make sure that us as healthcare providers, or even just regular people who have more awareness, that we know more about COVID-19 so that we can share that information so people are less afraid and don't need to be fearful of people who are positive.
Yes, thank you for that, Dr. Harrison. So education is pretty important. So Dr. Webb, we've had cases where persons are now living among family members and they have to take care of loved ones, even the ones they're resentful of. What advice would you give someone who is in the position of taking care of a caregiver who has been abusive in the past, in childhood? What advice would you give that person?
Wow, that's a tough one. That's so sad and unfortunate. You know, one of the things I talk with my clients about that's very difficult at times, but we can work through the process, is the process of forgiveness and what that means, you know, because forgiveness is really about, forgiveness benefits you, the person who's doing the forgiving, right? It creates this sense of peace and a sense of boundaries too. You know, if I can forgive somebody, then I am no longer maybe angry or frustrated or struggling to kind of be with that person. Because if I've forgiven them for who they are or what they've experienced in life or what they did to me, then maybe I can have a better relationship or caretaking relationship in this case with the person. So forgiveness, I think, is key. The other thing is self-care. If I'm having any type of caretaker, but in this case, of being a caretaker of somebody that has harmed you in some way, it makes it even more difficult. I would need to make sure that I am taking care of myself and setting those boundaries and those limits. You know, I need this time so that I can take care of my family member or loved one. So definitely I would encourage working through forgiveness and making sure that person is really taking care of themselves.
Okay.
And reaching out for help. Another thing is, you know, reach out to others and say, I need some time. I need some help as well. You know, you never know. Some people might, I said that to a friend of mine who is having a difficult time taking care of a family member. And I strongly encouraged her to reach out to some of our sorority sisters and even some of her family members and say, look, I need a break. I need a night in a hotel. I don't need to go far. I just need to go down the street to a hotel to find some peace. And 3 people stepped up and said, I'll stay the night with your family member, you know. And she actually stayed 2 nights at the hotel. So 3 people stepped up. So one person stayed Friday night, another person stayed Saturday night, and she was able to have a weekend at a hotel by herself. So reaching out and asking for help is another one.
Okay. Thank you. So the forgiveness, which needs to come from the person releasing the hurt that's associated with the abuse itself. Self-care is important as well as boundaries. Okay. Thank you. All right, so Dr. Harrison, going back to you, what about taking care of physical health? So most persons are, they've been sending in questions about eating a lot, about not gaining weight, about even fear of going for well visits because they don't want to contract the COVID-19. What advice do you have to give for the physical health?
Okay, thanks for that question, because I think it's a very important question. It's a little bit better now, but certainly last year, a lot of persons were not going for checkup visits, not going in to make sure that they'd gotten their vaccines for other illnesses. In the case of children or in adults, you know, some were not going in to get their prescription refilled and that sort of thing. depending on where you go and who you go to for follow-ups. Oftentimes, even if you can't necessarily come in for a visit, it's important to make sure you touch base with your healthcare provider, perhaps get a prescription refill called into the pharmacy or something like that, so that you maintain that continuity. But I think it's also important that we, don't become so fearful of leaving the house that we put our own health at risk. So, following the typical things, maintaining your distance, making sure you have on an appropriate mask and keeping the mask on, making sure you do your hand washing, you come home, strip down, bathe if you need to afterwards. So those basic things to ensure that you still go out. But a lot of persons, yes, do have quite a bit of anxiety to get out and go anywhere. And I think we have to temper that and recognize that we have to do what we need to do, but do it safely. The other thing that I think is critical is, as you mentioned, looking after physical health. I know a lot of people's sleep cycles have just gone totally wacko because, you don't have a typical day. You can work online, especially for young people who are in school or university. They can be in class from their bed. If class starts at 8 o'clock, you might roll out of the bed at 7:55 and do that. And so that can throw off sleep. It can throw off eating. I have lots of teenagers that I know are having breakfast at 4 p.m. because, they just hang out in their rooms until 4 p.m. when school is over. And so I think it's really critical for us to encourage them and enable them to develop a structure to their day. It doesn't have to be a tight structure, but there needs to be some structure because the mind gets a sense of calm, I think, and is put at peace and at ease if it knows what's coming next on a daily basis, kind of a thing. And also to find interesting and innovative ways to not be in the room with the four same walls, so to come outside, go for a walk. If you live in an apartment complex, so some of the university students, like grad students, do some flights of steps, If you don't want to go for a long walk or whatever, just climb up and down the stairs a few times for the day so that you get your blood moving and your muscles a little energized. I've advised people to, if you have space in your backyard, do a little bit of gardening. Gardening is quite peaceful. Find easy things to plant, and making sure that it becomes a part of your day, that exercise, that moment of self-care that Dr. Webb spoke about. That can be you just sitting and having a cup of tea by yourself in your own space without anything, no phone, no nothing, and just, a husa moment. And I think it's critical because I think lots of persons don't realize the multiplicity of physical symptoms that you can get from anxiety and depression. If you're depressed, everything can hurt you. Your head, your neck, your shoulders, your tummy. You can just feel lousy. And if you don't have that insight to recognize the connection between the two, then you don't realize that, listen, I need to be looking after my physical health so that I can, be stronger and better able to deal with all the emotional stuff that's going on that I don't have control over. So I think it's critical for us to do what we can do so that the other things that come at us are not piling on top of others.
Yes. Thank you. So routine, very important.
Definitely.
And especially because we've removed the structure somewhat in terms of school and even work. So we definitely have to implement a routine as well as a shift in perspective.
And now that you say routine and at home, just to remind those of us who are working from home, to have a cutoff time for work. When you're doing online work, you can just work all night, all day, and you have to make sure that you stop, especially if for people who are not leaving and going to the office to see a client or a patient, but you're doing it from home. You have to make sure to give that cutoff time to do your self-care.
Yes, for sure. And it goes back to the boundaries that Dr. Webb spoke about.
Absolutely.
Yeah. Okay. Thank you, Dr. Harrison. So I have one last question for Dr. Powell, and then I'm going to open the floor for you guys to ask your questions. So Dr. Powell, I don't know if this is a fair question for you, but it has been posed. I'm gonna ask it. We have been getting an increase in the daily rates from daily rates of COVID-19. From a researcher's perspective, when should we be alarmed, and when can we breathe a sigh of relief?
Okay. Well, I think it's fair, everybody, at this point, it's already alarming. I really hope there's nobody out there right now that is unfazed at this point. I really hope not. But I'm sure there's at least one. So I'm going to stick more to the sigh of relief piece. I think that's the I'll try to tackle that, and by all means, jump in anyone who can. The numbers are always increasing. I got word recently that Canada has gone down on a second or a third or a fourth. Quite frankly, I'm not even sure that number right now of lockdown. No, because numbers are increasing. Why are the numbers increasing? It's because of that fatigue that took place before, because people have already started to sigh. We've started to sigh too early. And, we have governments that's opening up their countries too soon, because, people are banging on their doors. They want to get outside and so forth. And governments want to appease these people. So we've sighed too early, and therefore the numbers continue to increase. I think when we can actually, or we should actually sigh, is when, and the rest of the panel, I've mentioned it to some extent as well, is education. It's through education, right? It's once we've got to a point where we don't have, and I was reading the chats as well, and somebody asked a question about, conspiracy theorists. When we don't have that many people who are believing these conspiracies in terms of, oh yeah, this is just a ploy, it's not real, people aren't actually dying. Well, the numbers suggest that people are. So I think when we can say that we've educated enough everyone to a large enough extent where we're taking this more seriously, then we can start sighing. When we can reduce the number of anti-vaxxers, then we can start sigh, right? When all peoples have access to vaccine, here there's a large struggle with the non-white population of where vaccines are. Some people have to go 45 minutes or 4 hours away to get to the closest outlet. And the government is doing a better job at trying to ensure there are places that are close by to everybody. The last data I read was they're trying to get within 5 minutes of everyone, there's a vaccine center. When we can get to there, that's when we start breathing that sigh. But we still have to get people to want to get vaccinated first, right? So we have to get them to want to be vaccinated. We have to get them access to this actual vaccine. Then we can start breathing this sigh of relief. When we have psychosocial education and training for everyone, so that there's not that level of bullying or jarring for somebody who received it or made to feel little because you've decided to get the vaccine. When we can provide that level of education, so that people recognize, one, not just the importance of what is happening, but just because somebody's made the choice, the conscious choice to get vaccinated, you don't say, oh, you can go on. Or I love hearing this one. Oh, did you know that I Am Legend, the movie, started because of vaccine gone wrong? I mean, no, I really enjoyed Will Smith in that movie. It's a good movie, right? But like I said before, these vaccines have been tested before, and they continue to do testing. So I think we're in a good space. But until those things, these social things get changed via education and a more opening up of opportunities for all people, that's when we can breathe a sigh of relief. I can't give you a specific number based on what the question is asking. I cannot give you some stats for that. But once we make these social changes, I think we'll be in a better place to start thinking we're close to the end.
Okay.
Dr. James, if I can jump in from numbers.
Sure.
I think that was a rough question though, Marvin. So I would say from our scientific, from the medical side of it, the microbiology side of it, certainly the positivity rate is a big concern. Meaning, of the number of people that get tested, how many come back positive? That's a big concern. And I think most countries would say they would breathe a sigh of relief if they're under 5%. And we are way up, like in the high 20s and the 30s. So we are far from that sigh of relief currently. And just to put the local spin, because I think for Dr. Powell and for Dr. Webb, they're in the land of being fortunate where so many millions have gotten the vaccine. I mean, USA is even far ahead of Canada, you know what I mean, in terms of vaccine administration. So they're way ahead. And I think they put a good plan in place to be way ahead. But for us, A, we're not going to get sufficient vaccines to do everyone. And B, we have some loud anti-vaxxers, which unfortunately persons share the anti-vaxxers comments, sometimes unknowingly, just because, you have access to social media. So you can read whatever is on Instagram, whatever is on WhatsApp, and there's so much garbage on all of them, depending on who posts, and it creates so much confusion. So I think it's, for us, we are far from that sigh of relief. I don't think vaccines are by themselves will be our answer. It will have to be vaccines in addition to all the other things. It can't be vaccines alone. We're not going to get enough of it soon enough for that to make the difference. So yeah.
Okay. Thank you, Dr. Harrison. So we still have to play a role with in engaging in the safety measures. Yes, you're on mute. If you were responding.
Sorry, no, sorry, Dr. James Bateman. You had asked me something, I think I missed.
No, I was just saying that we still have to take responsibility for the safety measures. So in addition to vaccine.
Yeah.
Yes, okay. All right, so I want to thank our panelists for this segment. I am going to open the floor for you guys to be able to ask some questions. So what we're gonna do is you can raise your hand and we'll go based on the first hand that was raised, and unmute your mic and ask your question.
Dr. James, I also saw a couple of questions popped up at some point during in the chat. So maybe somebody can look at that as well to see if there are any questions until people start to raise their hands in abundance.
Right. So Chris, you have your hand up. So please unmute your mic.
The host has to open the option for them to unmute.
Hello, are you hearing me?
Yes, hearing you.
Yes, okay, so I had been one of the questions that was in the chat previously. I think Dr. Powell had addressed it somewhat, but I have some friends where it's just like, they're sending me a lot of these articles where they're saying, oh, see, this is the reason why the vaccine doesn't work and you shouldn't be taking it. And I'm like, yes, of course. 25 cases out of the millions of people having an aneurysm is the reason for not taking the vaccine. But, you know, I kind of want to know how to give them the resources where they can properly educate themselves and how to kind of tell them that what they're looking at may not be the most accurate information to base, you know, their actions on. Also, I have a lot of friends that are very afraid of going outside or leaving. And I think what Dr. Harrison had said about knowing the risks, I would like to kind of get more of an understanding of how to bring that across, because I know a lot of friends are becoming almost agoraphobic when it comes to, you know, not going outside and not exposing themselves to other persons. So just those two questions.
So I can take the first one. So Chris, I think some good websites to use would be the WHO website and the CDC websites. Those are very good. In terms of vaccines, I know we recently had a pediatric conference where Professor Celia Christie had kind of gone through the vaccines in really good detail, but easy to understand kind of detail, and that should be on the Pediatric Association's website. So that's also something else that they could look at in terms of getting unbiased information. And then your second question about agoraphobia, I will hand over to the psychologist.
Before the psychologist jump in, because I definitely can't touch that question either. I will also add, Chris and others, how you'll be able to identify research versus just search, right? I would suggest not only looking at the website itself, like the CDC and the WHO, those, you can trust those type of information because they're, the global type information. But I'm always skeptical of articles that do not provide me with references, right? You need to be critical in your, not you specifically, Chris, but generally, right? As we consume research, we need to be critical in what is being said to us, not criticizing what we've said to it, but think critically about what is happening. Go dig deeper. Don't just read one page from Instagram or Twitter or one random website that has a URL with 5,000 question marks and dollar signs, right? But do they provide you with some form of reference that you can go check out that reference to corroborate what was said by those people? So that's one way I think you can always decipher truth in terms of research truth versus opinions. So look out for stuff like that. Send me somewhere else that I can corroborate what you've said. And now we turn over to the psychologist, right?
Good point, Dr. Powell.
I'd just like to say, I think it's so important, and I think this applies to so much of what we're experiencing now in 2020, 2021, is just patience, patience with one another, to be patient with our colleagues or our friends who are very fearful of going out, and understanding, patience with our friends and colleagues who are anti-vaccine or pro-vaccine or what have you, and just understanding that at the end of the day, we're all human and we all come from our own perspectives because of our own personal experiences. And so we're in this era, especially now with social media and comments and everything and the back and forth, where everything is now a debate and everything is now a pro or anti, or we're staunchly on different sides of the coin when it comes to all of these things. But everything we're discussing is so nuanced. And at the end of the day, I think that if we all came from the perspective of just being patient with one another, understanding and taking the time out to hear another person's perspective, sharing our perspective, because a lot of I think a lot of people, especially in this space now, a lot of us come from this kind of science background. And so, as Dr. Powell said, we understand the difference between anecdotal evidence and scientific evidence. And the fact that, one person who this happened to them, it doesn't necessarily mean that that's a call to, scrap the whole thing. And so exercising that patience and then using analogies, when we talk about the science and we talk about the ratios and we talk about statistics, we can use analogies. What's the likelihood that you're gonna go outside and get into a car accident, and is that likelihood higher than you getting COVID or what have you, and using those techniques with patients to have these discussions with each other, to not back down from your point and to not back down from wanting more information and wanting to give more information and educating others, but also to just remember the human, as corny and as cheesy as that sounds, but to really remember the human component of things, and to remember that each person is coming from their perspective because of their own personal experiences.
Thanks, Dr. Boydeen. So it seems a bit of empathy is important, empathy and patience. Dr. Webb?
The only thing I wanted to add was maybe focusing on the question regarding agoraphobia, and that's been a topic that's come up quite a bit since the pandemic. And I just got a new client about 3 or 4 weeks ago with agoraphobia as well. There's treatment for it, and agoraphobia falls under the anxiety umbrella of diagnoses, and you can't be anxious and relaxed at the same time. It's impossible to be both at the same time. So not that I'm, Chris, not that I want you to be a therapist for your friends, but, I just want to let you know that there's help out there for if your friends are wanting that. And what I do with my clients is first I teach them relaxation skills, but because again, you can't be anxious and relaxed at the same time. So first I will teach them relaxation skills to help them calm. And then the next step is what we call exposure therapy. So think of, say, like a triangle or a diamond, and helping my clients be exposed to things that are not as heightened in anxiety. So like the top of the diamond will be going to a crowded, say, indoor restaurant, right? That I still haven't done that because that gives me quite a bit of anxiety, right? So, starting with the base might be just sitting outside on a veranda or something. And then the next step is spending some time in the driveway. Then the next step might be taking a long drive on a day that's not busy. Like here, taking a drive somewhere on a Sunday, staying in my car, and then coming back. And then the next thing is taking a drive, getting out into a park where people are spread out, and then come back home. So eventually, after time, being exposed to things until you get, like, again, I'm still not ready to go to a restaurant. I'm still not ready to get on a plane, but eventually I want to go to a restaurant and get on a plane. So as time goes, and, I've been vaccinated now myself, so I feel more comfortable. Actually thinking about going to an outdoor concert soon, where they're gonna have we sit out on our own blankets and can spread out. I would never have done that before being vaccinated, but I couple this with relaxation. So that, along with sometimes medication, is treatment for agoraphobia.
Thank you, Dr. Webb. So step by step, a gradual process of relaxation, and maybe we can throw in Dr. Bowie's patience as well.
Yes, patience, yes, and having compassion, like you said, self-compassion, as well as compassion for others. So yes, what Dr. Bowie was talking about is very important.
Yes, thank you. All right, so we have another question from Dr. Beckford. Orville Beckford. Oh. Can we unmute Dr. Beckford?
Thank you very much, Carol.
You're welcome.
And want to thank your panelists who have been so helpful in explaining and preventing some of us from getting mad. It's a difficult time. A number of us are engaged with children. So my first question is to Dr. Abigail Harris. Those of us who are involved with schools, because I'm on a school board, and I also have some children in Grants Pen that I try to look after during this difficult time. How do you know when they're going off rail? Because not all of them will have physical outward behavior. But how do you know? Because you don't live with them, so you can't know if they're wet in bed, you can't know if there are other things, but you see them every now and then. For children, how can you know if the pandemic is resulting in some kind of mental illness? That's one. And then two, to the psychologists now, we are in campus teaching, not physically, so we have a lot of students who, for the first time this week, a student actually emailed me and said to me that she thinks she's having mental issues because of the pandemic. That is why she's not answering in class, she's not saying anything, because she really just can't cope with everything that's coming at her, including me harassing her about not speaking up in class and so on and so forth. What are some of the, I heard from Ms. Webb, some of the strategies, but just for students, would you have any additional strategies in terms of coping strategies for them, their mental state during this pandemic?
Okay, so I guess I'll start first since I got the first question. It's a little bit difficult if you're not living with them or regularly interacting with the children. But what I would say, some of the things that you might notice is that if you normally have sessions with them, like, you all meet up and talk or whatever, if they're not coming to those sessions as they typically previously would, or if they're not as engaged in the session, or if you find that they're more easily distracted, or their countenance has changed, their affect is different, they're just not their typical self, I would say don't wait on them to be drastically different. But if you're noticing a little change, have a little one-on-one talk. How are things going? What's good? What's bad? What's helping? What's not helping? And then the other flip side would be for the parents or guardians who are living with their children. The things to look out for would be, changes in sleep. You might choose to get into the war of a lifetime by saying, listen, at midnight, your cell phone needs to be put on my chest drawer. And that's it. Just be cold turkey, because they will be on that phone until 5 a.m. And then said, I can't sleep. Well, of course you can't sleep, because, if I was on my phone too, I wouldn't sleep. So sometimes you have to do that. Look out for changes in their appetite, not so much the timing of eating, but the actual appetite. We're seeing a lot of disordered eating flaring. Look out for them, not talking with their friends. So even for you, Becky, like if, they used to hang out with a particular friend and you notice that I'm not hanging with that friend anymore, those are some of the things that can point to that, they're pulling back. They used to draw, they don't draw anymore. They used to sing 1 and 2 song, run to DJ, and they're not doing that anymore. Those are all signs I think would be signs to suggest, let's get a little bit more help.
Thank you, Dr. Harrison. So before Dr. Webb responds to Dr. Beckford's question, I just wanted to mention that, all right, we have 3 more hands after Shamika. That will be it for the questions. Dr. Webb.
So regarding the question about the university student, I think before this event started, the university, the counseling center spoke about the services that are offered, right?
Yes. So there was a recording about
yes, there's a record. Yes, so it, letting that person know that they're not alone, that what they're experiencing, I don't know anyone who hasn't been negatively affected in some way, shape, or form by this pandemic. but that help is out there. And even if you want to share the link to that recording that was offered at the beginning of this event to let the student know what campus support is out there.
Yes, we will. We will. Thank you. And just to add to that, so yes, there's help from the health center, but and in addition to normalizing what we're all going through, what I would encourage students to do is to also talk about. So if you get the opportunity, so Dr. Bowie mentioned that she has space in her class to talk about, so what's going on, like a 10-minute. If you're able to have more conversation about what is going on, then that can be useful because you're not stuck with the information. And also when you've had moments where you want to pull back and you don't want to engage with class, with your classmates or with your studies, I'd say to try to do the opposite of that. So just show up and then take it from there, rather than retreat and isolate, because what happens is that once you start pulling back, then it continues and then it cycles. So we want to push against that. All right, so we have Ricky, Chantel, and then Shamika. So one question each. Can we unmute Ricky? Thank you.
I think he's still muted.
Ricky's still, okay.
All right, can you hear me now?
Yes, we can hear you.
Hi, good afternoon, everyone.
Afternoon.
All right, my question is, well, Dr. Powell mentioned something earlier about educating the population, read the conspiracies and so forth. But my question is, what mode of education would be more effective, since our population do not like to read, right? And the artists are more influential than whatever is placed in a book or an article or something like that, right? So how can we overcome those obstacles together?
Yes, thank you for that. I think you just answered the question. I think that's a very Instagram popular culture is definitely what we also have to find out, who is it that needs the most education in terms of where the resistance is, where the resistance is coming. Once we've identified where the resistance is coming, I think we'll be better equipped with educating that populace. But that's a great idea. Put it in the dance hall. I remember when I was at UWI and they had a dance hall class, and that class was full of vibes, right? The students learned a lot. So yeah, put it in the dance hall. Let the artists, let the sports figures, get them to buy into it. And here in the US, one of the things that they've used, basketball legends is one of the people that they've solicited those type of help from, to help with that education. So yeah, have a party, let Beanie Man, let Bounty Killer talk about it. But yeah, no, I think education is definitely helpful and useful for that. That's definitely a very captivating way to get a hold of a particular piece of the culture in terms of the population. But we have to find out where the most resistance is coming and from where the resistance are coming, and then tap into those as well to use different things. But that's a great suggestion too.
Can I add something just quickly to that? That I think adds to this question and the question from Dr. Beckford. I think we also, I'm sparked by this based on what I see from Denise Tittle, beginning with your social group. So I think it's also important to remember that as one person, as one human, you're not responsible for convincing everybody that this thing is the right thing to do, or convincing them of the truth. As one lecturer or one person, you're not responsible for your entire class's, mental health or every child that you interact with. So for us as individuals, because this time is so overwhelming and because it's so emotionally taxing and stressful, it's also important for us to recognize what our boundaries are and what our limits are, what we can do and what we will just have to leave to, the rest of society, because we're going to end up overburdening ourselves and stressing ourselves out too much in terms of thinking that we have a responsibility to do all of this. We do have some amount of responsibility, but each of us is just one human being. And so identify what you can do in your social circles and where you have influence, and work within that, and then just kind of decide that this is how far you can go, because otherwise we'll be too overburdened with this sense of, we need to make the world better right now. What can I do, etc.
Thanks, Dr. Boydeen. So being realistic in the amount of people we reach. Chantel. So can we unmute Chantel?
All right, thank you. Good afternoon, everyone. Thank you for this session. It was very informative. So my question is, since in Jamaica in particularly, we have several lockdowns so far, and some persons' situation is not ideal at home. They're either isolated, as in they live by themselves, or they may be in a situation where that either may be abusive or they just don't get along with the people in their home. And I just wanted to know, what would you say to them? What could they do to find some type of peace during lockdowns? Because there might be many more coming. Right.
Okay, thank you, Chantel. I don't know if Dr. Webb or Boydeen, you want to respond to this one?
Since I'm not there, I'm not sure of all the restraints and restrictions that are there in Jamaica, but I mean, this is where thinking outside the box and being creative, has to come in play. And then I don't know if the person does have access to technology and virtual things. There's so many virtual, there's virtual support, but also I found so much sense of connection and happiness from even these dance parties that have been on, YouTube, DJ Cassidy and DJ, is it Nice? I mean, it's just things like, and that type of stuff, as well as exercise. I used to go to the gym before, and I had to find a way, like Dr. Harrison was talking about earlier, is having a routine. And exercise became one of my best friends during this pandemic. And thinking outside the box in terms of trying new recipes. I mean, again, because I did not go out of the house much at all, March through July, really, last year when we were on lockdown here. So it's very hard. It's not easy, but you have trying to think outside the box. But the university there, as well as I'm still offering telehealth. So a lot of therapists are doing telehealth therapy, so you don't have to leave your home. But again, this is if folks have access to technology. I mentioned in the chat earlier from Amazon, I ordered one of those adult coloring books, early adult coloring books, and a pack of colored pencils. And I had not colored since childhood. And I found peace during that, as well as apps. There are quite a few apps out there. One of the new ones, there's a new app for meditation and wellness and stress by a group two women of color. So it's made for people of color. It's called Shine. Shine is SHINE. And then I always love an app called Calm, CALM, as well as Headspace and Insight Timer. So those are some of the apps that I recommend folks use to kind of ease anxiety and depression as well. So I hate to say this, but self-care, nutrition, exercise, connecting with others, and thinking outside the box. I know so many people who have never even planted a plant, and now they have vegetables, fruit, herbs, things in their garden because they even raised planter gardens. And these are folks who've never even touched the dirt before. So.
Thank you, Dr. Webb.
Oh, let me add to that. I know we're talking about a lot of overwhelming and stressful things, but another thing that I've helped my clients see, and some of them have even brought to me, is what we call post-traumatic growth. So some of the things I've mentioned, some people have improved their health during this pandemic. Some people have improved their skills. Some people, like Michelle Obama's talked about, she now knows how to knit. I've improved my cooking skills. And my husband will agree with that. My cooking skills have improved since this pandemic. I've been watching some cooking demonstrations on Instagram. So, and I've copied some of those recipes. I made my friend some good brownies for her birthday from a recipe online. So some people have grown, learned how to set boundaries, learned how to be assertive, and engaged in I have never engaged in this much meditation in my life. So I have grown in terms of practicing meditation during this past year. So there has been some post-traumatic growth that has come out of this pandemic.
Yeah. So it's shifting from the stressor that the person is experiencing and finding alternative ways of growing and expanding and becoming creative and taking it on as a challenge and getting some lessons from a negative situation, turning it into something that's positive.
I never was a morning exerciser. Now I'm exercising in the mornings early before I start work. I never did that before. So now I just get out of bed and I work out.
Yeah. Yes, yeah. Those are some good suggestions, Dr. Webb. Thank you. All right, Dr. Boydeen.
I think it's helpful too when you can have a plan for how and when you'll do all of these things. So having a plan to say, this activity seems like it may work for me, or doing this, or structuring my time in this way during the lockdown, and just have a plan in place so that when those moments come about, when you feel like you're getting stir crazy, you have that plan at hand, and you can pull on those resources that you've decided on before. Yeah.
Okay, thank you. And then the last question is from Shamika.
Are you hearing me?
Yes,
Hello.
we're hearing you.
Good evening, everyone. As I said before, I am not from the University of the West Indies. I'm from VTDI. Okay? All right. I want to thank Dr. Webb, because she was the one that was saying to me that she colored in the summer and all of that stuff, because I mentioned that I needed an anxiety coloring book for myself because due to my situation. However, I've been like doing therapy from last year November coming up because of the reason of having anxiety and insomnia. However, due to the recent incident at my home, and why I said I was alone is because I am the firstborn. My father is like been going back to the hospital, back and forth to the hospital due to his heart attack and his stroke. So being the firstborn and having responsibility, it puts a lot of stress on you as a firstborn, because you have to help your parents, and then you have to think about school, and then if you're not thinking about school, you have to think about jobs as well. However, being having parents that are not, or how would I put it, not computer literate and not have that education to able to write a resume, to look a job. I have to do it all for them. My parents are depends on me as the firstborn. It's two of us here, my little brother and me. So however, um, in terms of anxiety, I have a question in terms of that because recent incident happened at my home, and then I can't like sleep at night. If I do sleep, it's because if I do sleep, it's because my subconscious is like my brain is like literally running, but my body is physically tired. I don't know why, but I need something to help in terms of getting my brain to like shut down while my body is sleeping. I don't know why, and I don't know how to explain it no further than that. I've been trying to explain it to my psychiatrist and all of these persons, but them don't really understand because living in a area where things are being happening in your environment, it impacts your life as a student and as an individual. So yeah. So I need something that can help me to like sleep, not having nightmares, because sometimes I do feel powerless most of the time. I do not know why.
Thanks for that question, Shamika. It seems like you're undergoing a lot of stress. It also seems as if you have some professionals there to help you, but whatever it is that they're receiving, it seems like they're not fully getting the picture. So Dr. Webb had mentioned some relaxation techniques, self-care. And I know it's challenging given the stressful situation you're in, but if you can carve out time for yourself, just some me time to be able to relax, to be able to use that coloring book, to think about, make a shift in terms of how you're looking at the situation. So just in terms of your own perspective, your own take on it, because you are showing up for your parents, you are showing up for your younger sibling, and certainly in as much as it's challenging, it goes back to that growth that Dr. Webb mentioned, because you're still thriving despite the fact that this is a difficult situation for you. And what I would add is, if you're able to get additional help, like have a psychologist to work with you through this difficult time, I would strongly recommend that. I don't know if the other psychologists have anything else to add.
Yeah, I think, well, thank you, Shamika, for sharing. I think first and foremost, it's totally understandable that you're having the difficulty that you're having given what you've been through, and what you've experienced. And so please don't feel like there's something wrong with you. You're experiencing a natural reaction to something that is, to a situation and a circumstance that's extremely stressful. And so, that part is, even though what you're experiencing isn't pleasant, it's typical when someone goes through really difficult experiences like what you have described. It starts with really just practice, brief moments of practicing centering your mind and focusing your mind on one particular thing. Dr. James Bateman mentioned that, Dr. Webb mentioned these different apps that are helpful, but in addition to that, just YouTube. There are so many helpful videos on YouTube that focus on helping you to train your mind and calm and relax your mind. But remember that the mind, I like to make the analogy that the mind is like the body. And so when you're exercising a particular part of the body to strengthen it, it doesn't strengthen overnight. It doesn't strengthen by just doing one exercise one day. It happens with practice over time. And so I'm hoping that you can feel reassured that by trying to engage in some of these activities, over time, you'll start to see small changes. And you know, if I would say, don't rule out the possibility of exploring therapy for yourself as a means to help you, and even to just vent and discuss what you've been through. I think that could be really important too, and having somebody along with you on that journey to feeling better and feeling healthier.
Okay, thanks.
Thanks, Dr. Boydeen. I don't know if Dr. Webb has anything to add.
Just a little bit. Basically, just piggybacking on what Dr. Bowie just said. But thank you so much, Shamika, for sharing. I know it can be tough to share, but I'm so glad that you did, because so many, I've been reading just quickly looking at the chat, and other people can relate to what you're saying. So you definitely aren't alone in that. But I think you mentioned the psychiatrist, and I was just going to emphasize what Dr. Bowie just said about, and I think Dr. Harrison mentioned this earlier, the importance of sometimes getting therapy and medication. So combining both for some folks might be helpful. So I'm not sure if you're speaking with a psychiatrist alone or also a therapist, but maybe checking into both. And also, you did a good job of explaining your symptoms. And I think you mentioned that the person that you're seeing just doesn't seem to understand. But when I go to any doctor's appointments, I take my little turquoise journal, you know, and I make sure, because I want to make sure I mention everything I need to, and I don't want to leave without saying, oh, I forgot to mention this. And I write down what I'm experiencing, where the pain is, where the discomfort is, my eating habits, my sleeping habits, what have you. And maybe write down exactly what symptoms you're experiencing and say, this is what's happening to me, you know, so they're clear. So that's the only other thing I would recommend.
Yes, Dr. Webb. However, I am seeing a therapist and a psychologist, but however, it's like they keep on like giving me medication. My mother is the problem. My mother doesn't want me to take them. It's due to the fact that she's saying that I'm very addictive to it, because if I stop them, I can't sleep. So when I stopped the sleeping medication, basically, due to the fact that she is saying that I'm addicted to it, because it's like from last year I've been doing it. So she basically is just like, I just can't sleep.
Yeah, and sleep is extremely important. When the person's not getting sleep, everything else can kind of collapse, you know. And so maybe if your mom could participate in one of your appointments with your psychiatrist, so that your psychiatrist can explain and educate your mom on the medication and what addiction looks like versus what some folks may need to stay on medication for quite a while for the chemicals to change in the brain. So maybe if your mom could be invited to one of your appointments.
Okay, will do. Thanks.
Okay.
Thank you.
Thank you, Shamika, for sharing. And thank you, Dr. Webb, Dr. Boydeen, Dr. Harrison, and Dr. Powell had to leave for another engagement, so I apologize on his behalf. But I also want to thank our audience so for showing up, for also giving advice in the chat. So in as much as the experts are here, you're also experts in your own lives, and certainly sharing, someone can get tips from you also. So thank you, guys. With that being said, we're gonna close this segment. Okay. All right. Bye, everybody.
Thanks for having us. Have a good evening.
Bye. Thank you.
Thank you so much.
Everyone.
Bye.
Bye.